So I felt like at a very young age, this is like the thing that I cannot let happen. I cannot let happen to me, and I cannot let happen to anyone. So yeah, I think at that point, I dedicated my life to figuring out why is this a problem that we are not really addressing, this Alzheimer's, we're just kind of letting it happen. And I will also say that part of my journey was understanding that it wasn't even something that you would try to address as you got like older, like 60s or something. You had to address it really early on, like in your 30s and 40s. And that is not so much waiting for medicine to fix you because that's already too late. It's really about what you're doing with your life throughout your life.
Well, it's a real pleasure to have Siobhan Mitchell to the show. Welcome.
Hi there.
I'm super excited to talk to you. If anybody's watching on YouTube, you're all dressed up. It's all winter time or just end of winter,
Yeah.
I guess, in New Zealand. And so yeah, you're going to be heading to a warmer part of the year and we're going to actually talk a lot about mitochondria. And I'm super excited to talk about this and like take a deep dive. I've taken some episodes, we're just kind of brush the surface, but you've written over 80 research papers and you've spent 25 years studying how nutrition affects the brain. And you also get deep into the mitochondria. And I want to know how these two are connected. But you've really taken a deep dive into how nutrition may even delay brain aging. So what's the single most powerful dietary change that you've seen make a difference for brain health and longevity?
Oh, wow. I think it's almost unfair to say one dietary change can make a huge difference, right? It's a whole medley of things and it's about holistic lifestyle. But if I had to really start to go into one kind of nutrition thing that you can do, I've done a lot of research on ketogenic diet and also medium chain triglycerides, which generate ketones. I can explain how medium chain triglycerides work, but the quick gist is that you don't have to do a ketogenic diet to start having ketones flood your system. You can actually just take medium chain triglycerides, which are found in things like coconut oil, and get coconut sort of triglycerides turned into ketones pretty quickly. And this is, I think, really beneficial for your brain in many different ways. But one way is through the mitochondria. And basically, it's giving the mitochondria a fuel that it can use more efficiently, especially as you age. Because you're probably aware that with age, you actually get a little bit of a diabetes of the brain effect. Have you heard that term before?
Yes, type 3.
Yeah,
Well,
yeah.
well, I don't know how the effect is different than say type 3 diabetes, which some people say is Alzheimer's. Like, what's the difference?
I mean, I would say that Alzheimer's is the severe case of type 3 diabetes, where you're really having this loss of glucose use in the brain. But what is happening, even in, I would say, younger people, so people who are middle aged, is that we're using less glucose. And this is, I think, problematic because the brain is, as you know, the most kind of high energy use place. And you need to have that supply of energy at all times, or your mitochondria start to dysfunction, your synapses start to dysfunction, you're having like that kind of brain fog that people really associate with older age. And I will just say that I have particular interest in this because of menopause effects on the way you use glucose, which I can go into later.
Yes,
But
please.
menopause is one of these areas where your brain really switches in the way that it uses fuel. So really switches from using a lot of glucose to more fatty acid oxidation, which over time is not a great thing. And so I can go into that a little bit, but just in a nutshell, there's a lot of changes in different stages of life of how we use fuel. And all of this can make kind of complications with mitochondria. So if you're giving mitochondria ketones, though, that is a fuel that it can use very easily. And that's kind of like the safest fuel for it to use. Yeah. In these
Yeah.
kind of like lower energy sort of circumstances.
So yeah, I'm not sure if you follow Dr. Stacey Sims, who's also in New Zealand. She's
Yes.
yeah,
Yes.
nutrition physiologist, researcher, and she's all about women's health. And she's taught me a lot. I did her program Menopause for Athletes, and I learned so much there. And so she's not a big fan of, say, fasting and not even keto or any kind of diet. She sees that women in our generation going through menopause seem to train harder and eat less and trying to get into ketosis or fasting. And she's not seeing a positive effect. So, but at the same time, we have research showing, like what you said, maybe getting the ketones are really good for the brain. And actually, I like your hack that I don't know if we have to do a ketogenic diet, but we can just get some coconut oil or MCT oil in our bodies to, in fact, protect our brains. Is it work like that, or am I missing something here?
No, it works completely like that. So I tend to agree with Stacey that trying to get to ketosis is really challenging. And for sure, I looked at ketogenic diet is a proof of concept of like, hey, if you use ketogenic diet, is it going to help a brain that's not using glucose very well use something else instead? And this is for sure working in that way. But I would not recommend anyone just stays on a ketogenic diet for a long term or anything else like that. That's a little crazy.
Maybe we should explain what
So
ketogenic diet is. Some people may not even know and they'd be
yeah,
like,
yeah. All right.
what's
So
wrong with this
ketogenic
diet?
diet is really where you're trying to trick your body into thinking that you're starving. And the way that you do that is you just have no carbs or very little carbs in your diet, so just protein and fat. And once you get to this point, there's no more glucose in your body to use, your glycogen stores from your liver and all the rest have all been used up. You start to break down the fats in your adipose tissue, and this makes ketones. And then your body just uses ketones for fuel. And what's, I think, very fascinating about ketones is that because they're a starvation response, like your body's literally thinking like that no calories are coming in, it teaches the body to be very efficient, very resilient on its resources. And so this can be a very good thing. It can kind of stimulate autophagy and turnover and kind of getting rid of all this sort of like stuff that's building up inside our cells, for instance. And so that can be great, I think, is a short-term thing, right? Kind of just saying, all right, like let's reset button our body. But I would say just sticking to ketogenic for a long term is a little crazy. So yeah,
Yeah, well,
totally agree.
I think it started out as therapeutic diets and people who have seizures and they had really
Yes.
great results. And then, yeah, then there's research that came out, usually mostly on men who are thriving on it. And then when we put it into practice, it doesn't seem to go so well for females who are going through this transition, particularly. So, but I mean, I've seen when I was health coaching people, I would have men and women, and men definitely, they were responding well. The women were responding well, but after about a couple of weeks, they're like, I just can't do this anymore. I don't feel, I get just tired of eating so much fat. I miss my
Yes.
fruit. I
Mhm.
miss my vegetables. And we know these things are really good for you. So it was hard for them to maintain that. And I would love to know how we don't want to go on the other end of the spectrum and say, oh, let's just eat a bunch of processed, highly processed carbohydrates and sugars and glucose. And that's not recommended either, right? And this is why we call it diabetes. I mean, Alzheimer's type 2, type 3 diabetes. But where is that point? I mean, could somebody say, let's just get a balance, I don't know, 30 of all the macros and say, so they are getting carbs, but and again, I know this could be so specific. There are people who are exercising, people who are sedentary, people who are obese, people who are lean, and people have different microbiomes. So it's almost like so hard to generalize. But let's just take a generally healthy person and say, if you gave them a tablespoon of MCT oil per day with just a well-rounded diet, then could they, following, let's say, following a Mediterranean diet, because that's the one that a lot of people seem to agree on, would they be able to produce ketones and get enough to be able to
Yeah.
protect the brain?
Yeah. This is the idea of medium chain triglycerides is that they are this kind of shortcut to getting ketones into your system. And I can actually even go further. So yes, medium chain triglycerides are this kind of shortcut to making ketones where you're still having carbs, you're still having your cake and all that. But as I said, if your brain is not using glucose as efficiently, then you are now just kind of saying, okay, fine, you're not going to use like other types of fats because the brain's the one place that is not really capable of breaking down fats. It can use these ketones instead to fuel everything so you can kind of function normally. And Stephen Cunnane, I don't know if you've heard that name, has been instrumental in really showing that medium chain triglycerides given to people with Alzheimer's, with mild cognitive impairment, actually do show improvements in cognition over time. And they're also showing that even with their loss of glucose use in their brains are actually becoming more stimulated because they do have ketones instead to use. And furthermore, this is research that I have done. I have shown that medium chain triglycerides themselves can be signaling molecules into the brain that can actually stimulate, I would say, sort of better metabolism overall. So, for instance, I've looked at two different kinds of medium chain triglycerides. One is an 8-carbon triglyceride it's called caprylic acid, and then another that's a 10-carbon medium chain triglyceride, and this is capric acid. And what is going on with them is they're actually signaling different things in the brain. And I don't want to go into all the details because I could spend all night. But basically, we saw that one kind of triglyceride, so the 10-carbon one, capric acid, was much better at improving overall cognition in a rodent model, in a kind of rodent brain aging model. And we think this is because it's basically stimulating a better response of the TCA cycle in the mitochondria. And so I won't go into all the details because I know when you start to get really into the details of mitochondria, it gets a little bit confusing. There's the TCA cycle and there's oxidative phosphorylation and all the rest. But The idea is that it's actually kind of helping the brain get their mitochondria working better than they were before. And so the other thing that we saw with these medium chain triglycerides, which I thought was really cool, was that we showed in a rat model of high anxiety. So these rats would have a lot of anxiety. They had lots of social stress, interestingly enough. So they were not good at social interactions. When you gave them this medium chain triglycerides, it actually pumped up their mitochondria to the point where they were no longer having that social anxiety. They're actually socially dominant. And so
Wow.
it kind of cured their anxiety, which is really interesting because I think this is something we can talk about more, that there's a lot of evidence that the way your brain is using energy can also affect your mood and your overall propensity for anxiety. So this is, I think, like a whole other area that even if you're not that worried about cognitive decline, if you are having lots of anxiety, lots of kinds of feelings of panic, there's actually something that you could try with medium chain triglycerides.
Do you think, I mean, is there research on humans as well showing a similar effect, or we only have the mice models?
Well, so far, I would say like the conclusive data for humans is not there. I mean, there's been a lot of case studies. It's funny, this is all research I did at Nestle, and Nestle filed a whole bunch of patents on this, of course. And you can imagine when that happens, sometimes it stops some of the research from happening because someone else owns the patent. So, yeah, I can say that it's mostly kind of case studies right now, but I definitely have recommended this to various people over time and also talked to people who have tried this, and they do say it's very effective. It actually does kind of, I would say, almost the same thing as I said with ketogenic, like kind of set a reset button in their brains so that their mitochondria can kind of function a bit more normally.
Okay, you're going to have to tell us then, because MCT oil that you find in, say, a health shop is different than what you get just in coconut oil, isn't it? Or is that just marketing?
Yeah, yeah. So when I said that you can get medium chain triglycerides from coconut oil, it is true, but most of that coconut oil triglyceride is the carbon 12 triglyceride, which doesn't do any of these things, right? So what you can do is you can get MCT8 oil from, I think, various kinds of like medical sources. So Bulletproof has their own version of MCT8, the caprylic acid kind. For MCT10, the capric acid kind, which the one I think is better for cognition anxiety, there's not a lot of sources that I'm aware of. So maybe someone can check this on the internet, see if there is. The
Mhm.
best you can do right now is you can get a medium chain triglyceride mix, which is usually a mix of C8 and C10, and that can work pretty well.
Okay, I'm going to get that. But actually, I haven't taken coconut oil because I've been told by several doctors and I have high cholesterol and they said you should stay away from saturated fats, including coconut oil. And there's also this debate. There's people who are like, yes, that's true. Other people say no. Some people say it's genetic. Some people say it's a small population. Like, I'm still like, I'm waiting for the day that someone's going to debunk this for me and I can eat all the coconut I want. So, but with your experience and your knowledge about nutrition, what would you say for somebody who is concerned about saturated fats? Could they somehow get away with it?
Yeah, I will say that the data on coconut oil is mixed, right? So some studies have shown that you can take it for months and you're not showing any increases in cholesterol, and other studies are showing that there are some increases. So it's just really difficult to say. So I'd probably just caution coconut oil is not the sort of real solution here. I would say trying to find an MCT8 or a mix of MCT8 and 10 is the best. And you don't need to have a lot of it. You could probably just take 10 grams of it, a sort of
Less than a tablespoon.
overflowing tablespoon. Yeah, and that should be enough.
Oh, interesting. Okay, yes. Maybe I always recommend people just test, measure, and assess. That's what I do. And I've done my own testing. And when I eat a lot of saturated fat, I see my cholesterol and these numbers go up. Not that cholesterol is the only number, but that when I stop, it goes down and then it goes up and goes down. So you just do your own experiments. But also, if you are concerned about heart health and cholesterol, we have other episodes that have taken deep dives into the numbers and what does it really mean and why just that total cholesterol number isn't everything. But I digress. But I'm like so curious. I'm like, oh, I want to protect my brain. I love coconut. And I'm like, God, I just want to like go back and start eating coconut again. And will MCT oil, how would you do? Would you just drink it or you put it in a smoothie or what do you do personally with your MCT?
I mean, I've done just doses of it straight and then you just get over with. A lot of people do put it in their coffee. It kind of just is dependent on what you feel like is okay for you. I just tend to just get things over with. I mean, it doesn't taste great on its own, but it's very quick. It's just like a few mouthfuls and then you're done.
Okay. I'm curious to know, I know you have a backstory on why you're so interested in brain health. I don't know if we could briefly explain what or share a little bit your story.
Yeah, well, it is really about being very concerned with what happens to your brain as you age. And this is because my grandmother, who came to live with us when I was quite small, like 9 or 10, basically had developed pretty severe Alzheimer's to the point where she didn't know who I was. She didn't know where she was. She didn't know what was going on anymore. And she kept coming and asking us, like, how did I get here? What's going on? Lots of anxiety, lots of fear of just what is happening to me. She'd have a realization of that something is terrible, and then she'd forget again. And I just couldn't believe this could happen to someone. It was just really shocking as a young child to see that. And I kept questioning, like, why doesn't someone fix her? Like what is the problem? And so, yeah, like I will say that even as a very small child, like I think I understood that we are our brains, right? So it was just clear, like the person who used to love me, who was like the best, most warm grandmother ever, was just completely gone. And it was just frightening because there was still someone there, but it just was shell. So I felt like at a very young age, this is like the thing that I cannot let happen. I cannot let happen to me, and I cannot let happen to anyone. So yeah, I think at that point I dedicated my life to figuring out, why is this a problem that we are not really addressing, this Alzheimer's? We're just kind of letting it happen. And yeah, I will also say that part of my journey was understanding that it wasn't even something that you would try to address as you got like older, like 60s or something. You had to address it really early on, like in your 30s and 40s. And that is not so much waiting for medicine to fix you because that's already too late. It's really about what you're doing with your life throughout your life.
Mm. I am so sorry, yep, to hear that. And I know anyone who's has a parent or grandparent or friend or anyone who knows somebody who has Alzheimer's or any kind of dementia, it's a wicked disease. It's really wicked. And I think it can resonate with a lot of women here. And because this is a menopause podcast, we do take deep dives into hormones. And I'm wondering if you have any research or any thoughts in terms of taking exogenous hormones in terms of they say, quote unquote, protective benefits.
Yeah, I mean, I am sure you've had lots of people come into this podcast and say that they are very pro hormone, and I will say I am very pro hormone. So everything I've seen makes it really clear that it's better to have some sort of exposure to estrogen, progesterone, and these are very important for overall brain function. And I think what's really fascinating that I wish everyone knew about more is that the way that you might even start to understand that you are at risk for Alzheimer's is when you're going through perimenopause and you're having a lot of those menopausal symptoms, especially the hot flashes and the night sweats, that this is an indication that your brain is actually having depletion of the estrogen that you need to actually keep your brain functioning well. And this is actually also an indication that you are a higher risk for Alzheimer's disease later on. So, yeah, I would say having estrogen is very important in that respect. And I think you're probably aware of Roberta Brinton. Have you heard of her?
No, I know Dr. Lisa Mosconi and her research with
Yeah, she
estrogen in the
works with
brain.
Lisa Mosconi, but Roberta Brinton, I think, has been really instrumental in looking at how the loss of estrogen really changes how our brain mitochondria function. And so she's working on, I would say, a mix of phytoestrogens, right? So soy isoflavones, things like genistein and equal, to show that if you can stimulate at least the estrogen receptors, especially the estrogen beta receptors, that you can actually keep your brain kind of still in gear and kind of prevent that risk of cognitive decline. And this is also addressing, of course, those menopause symptoms. So one of the things she's shown is that if you're addressing some of those night sweats and things like that, you're also addressing cognition. And so her work is really cool. I definitely suggest people to check this out because she's a very complementary kind of researcher to Lisa Mosconi.
Oh, we'll have to see if we can get her on and
Yes,
dive
yeah.
into mitochondria in the brain and hormones. And so I'm wondering if this is too personal, you don't have to answer. Your own mother, if she's around, is she having, or is it, or maybe it's from your father's side? You said your grandmother, I don't really know, but is she doing anything is she on hormones or how's her brain health going and any insight there?
It's funny you should ask. So I was very aware of Roberta Brinton's work a while ago. I think even before she published this kind of understanding of night sweats being an indicator of cognitive decline risk, I started asking my mother when she was going through menopause, like, how are your symptoms? Are you having a lot of menopause symptoms? And happily, she had almost nothing. She was
Yeah,
fine.
yeah.
So I was thinking like, all right, you're not going to have that much of an issue. And she takes good care of herself. She's been one of those people that always exercises, always eats right. And very importantly, I think you're probably aware, is that she kind of just maintains good mood and good attitude and keeps herself busy and social connections and all those things. So I'm not as worried. And also, you're probably very familiar with this too. I have gone through all the genotyping that you can think of, and I don't see a lot of genotypes, at least for me and my parents, that seem to be indicative of like a familial Alzheimer's.
How interesting. Interesting. Yeah, because when we hear genes, genetic, even though many of us know maybe it's 10, 20% is genetic, the rest is lifestyle, diet and lifestyle, you still think sometimes those genes are pretty powerful, like even if it's only 10%. And to have have the whole family quite, yeah, quote unquote safe or in not having some of these major markers. But I'm so curious to know about all of these things when it comes to your own. When I interview people, like, well, what are you doing? Like, you're the
Oh,
expert.
yeah.
It's always, and it helps us get in a practical way. What are you doing? Like, we know what your mom is doing, which is fabulous. And I guess you're practicing similar things to protect your brain, right?
Yeah, well, everyone's story is a detective hunt, right? Of like what went wrong and who else in your family is having something similar to this and like what did they do and just trying to understand like the origins of disease as we start to see it kind of manifest those really early stages.
Yeah.
And what's interesting about my grandmother is when I was detective hunting what happened to her, it was clear that at some stage when she was going through menopause, she started using a lot of sleeping pills, right? And you're probably aware that when you take a lot of sleeping pills, especially the GABAergic ones, this is increasing your risk of Alzheimer's. And I think she took a lot.
Yes.
So, yeah, sometimes it's as simple as that. It's just that back then, no one knew that was not a good idea. They're just like, oh, you can't sleep and you're going through perimenopause. Like, here's the solution. And now we know that's not a good solution. But I think it's really just, yeah, kind of keeping aware of these kinds of patterns and trying to stop them in your own family.
Mm. Did she have a lot of surgeries and at all for any other reasons? Just in
No,
general?
not really. Just that, yeah, she just loved the sleeping pills. She's like, this is the answer. And so, yeah, like there was probably just a lot of abuse of that. And
Yeah.
it's probably, I think, almost a generational thing. I would not be surprised if a lot of women her age had been in that same situation. And I will say that it's interesting now with this generation, like there is a lot of problems with sleep. And so even though we know that we're not supposed to be taking a lot of sleeping pills, that's not the answer. I kind of also wonder that if we're still going to have issues because we just haven't learned to sleep right. And that sleep hygiene is one of those things that we all talk about it and then no one is really practicing it. And we really need someone to make it seem like this is a real thing. And interestingly enough, I was just reading a study that showed that, in fact, one of the reasons why we need sleep is it's basically to give our mitochondria a rest. So they were showing that as you're staying awake longer and longer, your mitochondria start to dysfunction. So they have improper fission and they have also slower electron transport, which is what you need to make ATP. So now there's this theory that the reason why we sleep at all is just to literally regenerate our mitochondria. So yeah,
Recharge the
I think,
batteries, right? I mean,
yeah, exactly.
literally.
So I would just even bring that into the picture as another reason that we have to take care of our mitochondria, and it's also sleep is part of that equation.
It's super interesting what you said about the sleep medications because, and the reason I asked about surgeries is because as we age, it's very often we have surgery for one thing or another. And I just had two hip replacements. And so I went under, like they give you drugs so that you don't remember what happened in the surgery, right? It's to sedate you. And so I understand as well. I don't know if it's called benzodiazepines or there's a drug.
Benzodiazepines, yep, that's
Yeah,
it.
those are also in, what are they? Antidepressants that women during
Well, they're
menstruation.
anti-anxiety medication.
Yeah,
They're like Valium.
yeah, it's crazy because very often women are not prescribed hormones. They're prescribed an anti-anxiety or an antidepressant. And if you're having this inside in your regular day, taking these medications, one-off surgery, fine. But if you're taking it on a regular basis, these are also helping us forget. It's acting on your brain. And that worries me. Is this going to affect us long term in terms of our brain health? I don't know if you've
Yeah,
heard.
I
Yeah.
think that is something that people are only just starting to really appreciate. And even just things like antihistamines, like Benadryl, have also been shown to increase your risk of Alzheimer's. And I know tons of people who use those all the time to sleep, for instance. And I'm like, you do realize
Hmm.
you're trying to like take care of yourself, but you're actually doing the exact opposite. So
Yeah, we got to try to get off some of these medications if we can. And I'm glad that you mentioned that hot flashes and night sweats are an indicator. to perhaps higher risk of Alzheimer's or dementia, but it's also a higher risk of cardiovascular disease or of UTIs,
Yes.
of joint issues, of many things. So if you're concerned about disease, because I meet a lot of women who are, oh, I'll just deal with the hot flash. It's not that big of a deal, or I can go through it. I would recommend, like you said, it's a brain thing. Like that's where this all sort of starts. So why don't we not ignore it? Just take care of it. You'll sleep better anyways. And then we know all these benefits are going to happen after we get good sleep and so on, and our mitochondria as well. And I want to dive a little bit deeper into the mitochondria because you're so focused on mitochondria and cellular health. I want to know, what does a woman in midlife need to understand about this? But why don't we explain briefly what is mitochondria in case somebody's completely new to this?
Yeah. What are mitochondria? So obviously they're the powerhouse of the cell. So usually that's what people remember from their biology days in high school of like, oh yeah, they make some energy for the cell. They make ATP, that's the currency of energy for the cell. But they're doing so much more. And I just want to have that awareness because what I would almost say is great about the mitochondria is that because they're making energy, they're kind of even deciding if a cell lives or dies. So they generate like the signals that maybe make you go into apoptosis. And they're also generating signals that tell the cell that we're under stress. Maybe we don't have enough nutrients and maybe we need to either be more resilient or actually basically give up and go into apoptosis and send out signals to the rest of the body that things are bad, let's have more inflammation, that kind of thing. So I have heard the mitochondria being called the motherboard of the cell, and I think that's really accurate. So it's generating that ATP, but it's also that canary in the coal mine of like anything that's going wrong in the body, it's going to affect the mitochondria. They're a very vulnerable place. And that sends the mitochondria into this alert mode that basically can send the cell into an alert mode. And then, for instance, cause more inflammation, cause a whole bunch of accelerated aging, for instance.
Is that the danger response that people talk about, where people say mitochondria can either, I think it was, yeah, the mitochondria can get an alert or a signal in saying that you're either there to produce energy and help us feel good and move about our day, or it can shut us down and make us tired so that it can go and repair damage that's been done, like if we get sick, and then it can fix whatever it needs to fix. So that's kind of like why we may feel totally fatigued when we're sick. It's our body literally shutting us down. It's like, go lay down, because if you start walking around, cooking food, going to work, doing your things, we can't fix the damage that's done in the body. And I think some people have called it I think it's called the danger response. And I don't know if it's the same thing.
Yeah, I mean, there are a lot of danger responses in the cell. And for instance, there's something called like the integrated stress response. There's something called the damage associated molecular pattern. And these are all signals that basically can go out to the rest of the body and, yeah, either trigger inflammation. And you're right, inflammation, basically, once these sort of inflammatory cytokines get to your brain, are literally signaling to your brain, like, you're sick, go rest. You need to get better, go rest. And in fact, there's an interesting hypothesis that a lot of depression is basically inflammation that's just making you feel tired and kind of sad and mopey all the time. And so, yeah, that's basically what is happening a lot with mitochondria. They're kind of basically signaling to you, like, go rest, or we're not making as much ATP, go do nothing right now. And then the other thing, I don't want to omit this, is that they're making a ton of oxidative stress. And I'm sure you had discussions about oxidative stress, but what's interesting about oxidative stress is that the more ATP you're making, the more oxidative stress you're making. But, the mitochondria does have these kind of like, I would say, endogenous systems to suppress a lot of this oxidative stress. But as you age, you are losing that ability, that endogenous system. And so there's a lot of data, and I would say hypotheses around the fact that this generation of oxidative stress from the mitochondria over time basically causes aging. So there's obviously these hallmarks of aging, and there's lots of other things that people talk about, like proteostasis or nutrient signaling or epigenetics. But I can also tell you, you can kind of link all of these to mitochondrial dysfunction is like kind of the reason why you might have epigenetic sort of like changes and the reason why you might have proteostasis. Oh, and for people who don't understand what I'm talking about when I say proteostasis, I will say proteostasis is just literally like proteins that are not working the way that they should, like so dysfunctional proteins, and then loss of turnover of those proteins. So yeah.
You're calling out a lot of these hallmarks of aging. We have a whole episode on that. And I think there were nine, and now maybe there's 12. There's all these hallmarks of aging, the things that people believe that are why are we aging or what's causing disease. And mitochondrial dysfunction is one of those things. And then the folding of the proteins as well. And then there's autophagy, and we can talk about mitophagy. And there's all these things that are just gobbledygook for a lot of people who don't understand these big words, but they're just showing you that these things can accelerate aging. And when you think about exercise, for example, that creates more ATP, more oxidative stress, more damage to the cells, but it doesn't mean, oh, we shouldn't exercise. But when you look at people who are marathon runners or ultra marathon runners or people who are really pushing it, if you were to test their biological age, they're quite old. And that's not a good thing. So I think things are always in balance. We need some things like, and even like you said, inflammation is, we need some inflammation, but when it gets out of control, then that's a big problem too. But what you did pinpoint on is that as we age, we have a harder time in fixing or repairing. So where is the balance? Like, what do we do in the sense that we should exercise less or what should we do about that?
Yeah, I mean, exercise is an interesting one because it is basically a way to teach your mitochondria to deal with stress, right? So it brings on this hormesis response. I think you've heard that term, where it's, yeah, creating a lot of oxidative stress, it's creating a lot of energy demand. And this teaches the mitochondria, like, okay, generate even more antioxidants to deal with that. Also generate even more mitochondria to deal with more of the ATP needs that you have in the muscles. So that can be all good. I will say at some point, exercise is not going to do the job anymore because like I keep on telling us people again and again and again, like the first thing that you'll notice when you're aging is that you can no longer have the physical performance you did when you were, say, 20. Like it starts to deteriorate really, really fast. And that is because I think of your mitochondria. Like your mitochondria basically in your muscles, for instance, are losing copy numbers as you age from every decade of your life from age 20 onward. And so, yeah, you can kind of bring them back up again with exercise. And that is why it's such the fountain of youth that we should all do. And I do a lot of exercise. But it's also, I think, something where your mitochondria, no matter what you do in terms of exercise, are still going to age. And it seems like they're the first thing that show aging of all the things that happen in the cell. So I think that's what's really interesting about them.
As I understand, we have most of our mitochondria in our muscles, and I think maybe the heart, or is it the brain? I'm not sure. Where do we have the most number? Because there are different numbers in different parts of the body, right?
Yeah, in fact, this is always an interesting one. The most mitochondria are actually in women and not men. And the
Really?
reason why is because they're in our oocytes. So our oocytes, so these are immature eggs that we have in our ovaries, have up to 100,000 mitochondria per oocyte. So it's a huge amount.
Wow.
And it's there because obviously once that egg is fertilized, it's going to need a ton of energy to divide and grow. And what I also say is that fascinatingly enough, it's probably the reason why the ovaries are the first place that you show aging in pretty much all the organs of the body, right? Because of all the organs of the body, ovaries fail in your 40s. Nothing else is kind of failing in your 40s. So yeah, it's just an indication that even with these oocytes that have all this mitochondria, like there's a huge amount of maintenance of that mitochondria. And if any of those mitochondria start to show issues in quality control, you lose that oocyte, you lose that egg. And we all know that once you get to what, like age 20, you've lost a ton of eggs. Once you've gotten to age 40, you've lost like up to 95% of your eggs. And this is because of all the mitochondria maintenance that is required, that is like kind of overwhelming. And if you've done anything bad in your life, if you've gotten a lot of, I hate to say it, like poor lifestyle choices, then your oocytes are going to suffer because those mitochondria are so vulnerable. So yeah, sorry, that was a long
No,
story to explain that
did you say there were
maybe people think
100,000?
about your, Mhm,
Did you say
yeah,
there were 100,000 mitochondria per oocyte?
yeah, yeah. It is the place in the body with the most.
And
So it's always a
where's,
fun thing to tell men that you wish you had that many
yeah.
mitochondria.
So what's the neck, like, let's say what's in a muscle, for example, is it relatively speak, like, let's give people an idea what,
Yeah, yeah. All right. So it's like 2,000
oh my
maybe
God.
per
So it's
muscle
like
cell.
way beyond, like it's
Yeah. And one
way
of the
beyond.
more, I would say, high mitochondria places in the body that people usually think would be high is like the heart, for instance, right? Because it has to beat all the time. The heart basically can never, ever stop. That's about 7,000 mitochondria per heart cell. So yeah, oocytes are
Below
crazy. They're
for
a
anyone.
crazy kind of cell. Yeah.
That's insane. I didn't know that. Unbelievable. And I guess what makes sense, it's such a powerhouse that if you're aging and maybe you need more energy going to other things, that's why it shuts down and says, I mean, there's many reasons why people think we would shut things down. And we know the lack of estrogen and progesterone, and but the ovaries are not making it anymore. It's just too expensive, maybe, because
The ovaries are not making estrogen because they don't have enough oocytes to kind of signal that estrogen production. And so that's actually kind of why our ovaries start to fail, is basically that we've run out of viable eggs. So it's really about all of that kind of signaling the ovaries like you're done.
unbelievable. So then, okay, then
Yeah.
the next thing that makes me think is that, well, if we were to improve our mitochondrial function or even increase, and I don't know if I understand exercise, for example, increases the number of mitochondria, or they're more robust, or they're healthier, then is there anything that could help us delay the menopause, or just improve our ovarian function as long as we possibly can through NAD and mitochondrial boosters, or whatever that may be?
Yeah, well, I mean that is where mitochondrial boosters totally come in. So I am so glad you asked this question. So for sure, MitoQ is, so I haven't talked about MitoQ
Yeah,
yet. I might
what is
talk
like,
about it a
yeah,
little
with,
bit.
then there's a long
Um,
name for that molecule too, mitoquinone.
yeah, so MitoQ is kind of like the, I would say, brand name of this molecule, mitoquinol, which is basically the world's first mitochondrially targeted antioxidant. So there are a lot of antioxidants out there. We've heard about polyphenols, we've heard about vitamin C, but I would say this is the only antioxidant that truly goes into your mitochondria, up to like 90% of it. And so it is really, I would say, that the thing that can help your mitochondria more than probably anything else you can take in terms of getting a huge amount into the mitochondria and then having a lot of protection against oxidative stress. So
Oh,
that's
wow.
the cool thing about MitoQ. And so you can imagine any places where you'd expect a lot of oxidative stress, that mitochondria are very vulnerable, like oocytes, like your ovaries, can have a lot of benefits. And so that's been seen in quite a number of studies. So MitoQ is helpful for improving oocyte maturation, so getting an oocyte to actual sort of viable egg form. It's also very effective for egg quality overall. And it's also very effective for decreasing things like ovarian fibrosis and other kinds of like aging mechanisms that can happen in the ovaries. So for sure, we don't have that data to show whether it can delay menopause, but it would make sense that it would have that kind of effect. And there are other types of kind of mitochondrial molecules, like I think you've heard of rapamycin, right?
Mhm.
Rapamycin. So it's another kind of mitochondrial molecule. It works by inhibiting mTOR, which has many different kind of signaling factors, but a lot of signaling factors for the mitochondria. And this in studies has actually delayed menopause in women. So it's almost like reversed their perimenopause. So these are some really cool studies. I don't know if you've heard these. These are out of New York.
No, no,
Oh, yeah.
share. Like, first of all, I want that study because I want to share it in a newsletter or something, because that's insane, insane. And then, yeah, no, tell us about, and in case people are like, delay menopause, can we do that? Yeah, we can. And we have enough research showing that there's certain diets and lifestyle things that we can do. There's other things genetically that we're programmed for that. But here we have a molecule that wasn't on my list. I even did an episode, just what can we do to delay menopause, and I didn't know about MitoQ. And so, what is the research showing in terms of you already talked about ovarian function, which is fabulous, but if there's anything specific to women in menopause or perimenopause that you could take
Well,
a
there is a very cool study that indicated that MitoQ might help with the vascular dysfunction that women experience after menopause. So, yeah, we were just talking about how estrogen is really important for helping with cardiovascular kind of, I would say, growth and repair. And once you lose all that estrogen, basically your vascular kind of reaction to, for instance, nitric oxide release, which helps with the dilation of your blood vessels, which helps with blood flow to all your organs that obviously need that blood flow like at all times, that goes down. So this study basically showed that if you just take even like one dose of MitoQ, and this is, I would say, quite a large dose, but with one dose, you can basically improve this vasodilation of women's arteries that have gone through menopause to the point where now their arteries look like premenopausal women. So basically, kind of just reversing that kind of loss of estrogen and that kind of aging of your vascular system. So I think that's really cool. And what was also really cool about this clinical study where they showed this was that they showed that this was really due to mitochondrial dysfunction that happens when you go through menopause. So they showed that, for instance, women that have gone through menopause have a lot more mitochondrial oxidative stress in their endothelial cells. So those are the endothelial cells in your vasculature. So yeah, if you can kind of get rid of that oxidative stress through something like MitoQ, you can basically get those blood vessels to start being the kind of perfect sort of blood flow kind of mechanisms that they normally are. And you can imagine this can have all sorts of great, I would say, additive benefits for the rest of your body as well, too. Like getting blood flow to your skin and your brain and all that is also very, very beneficial.
Oh, incredible. This will be interesting to know that sounds like it's very supportive for women going through this perimenopause and even postmenopause. But I'm wondering, how does it compare to hormones? Because you're quite pro hormones, because some of these things are similar, but I don't know the impact of hormones on the mitochondrial function. And then like, what would be better, or is it great to do both? Or if somebody can't do hormones, then great, we have MitoQ. Where are we with that?
Yeah, I would say that there's lots of evidence that if you're not interested in hormones for whatever reason, kind of incidence of cancer in your family or other problems with, say, blood clots, like this is, I would say, the other solution. And for sure, the idea of synergy of estrogen and MitoQ, like I think that is very possible. I would love to study this some more. So anyone who's listening to this podcast and they want to come out and see if we can do a collaboration, that would be super cool. So yeah, I think it makes a ton of sense that you could do both. But if you're not willing to do both, then I would say MitoQ is extremely helpful if, yeah, you're not into taking HRT or the other things that are sort of similar, like phytoestrogens, like isoflavones.
Yeah, there's a lot that we can do, and it's always nice to have more tools in our toolkit. But I want to go back to a little bit about the mitochondria, because we started to explain what it is and we know how important it is for energy systems and for the whole body to function really well. How does somebody know if they have any symptoms? What are the symptoms that our mitochondria might be under stress or declining?
Yeah, well, that's been, I think, a real problem of the research world in terms of aging is that it's really difficult to look at direct mitochondrial function. So, for instance, trying to isolate mitochondria from cells from like a human, for instance, and looking at ATP production or how much oxidative stress they're generating requires a lot of laboratory equipment and it's not viable for a clinician, right? So someone who's a patient. But there are a lot of, I think, indicators like biomarkers that are coming out these days that can give you a sense of your mitochondrial function. And I can list a few, but the other way you could probably tell if your mitochondria are having problems is that you're just having a lot of fatigue that is not explained by anything else. And I know fatigue can be one of those things where there's many different causes. You could be iron deficient, you could be magnesium deficient. That is all a factor. But if you are working on all those things and you think that you're having pretty good nutrition and you're still tired, this is where it could be mitochondrial dysfunction. So yeah, extreme fatigue, extreme sort of physical or mental fatigue, I think is a really good indicator of possible mitochondrial dysfunction. So those are one way you can know. And I will also just say that people who use MitoQ, that is one of the first things that they comment on is that, for instance, they have been feeling kind of like worn out, or they have had that feeling of like, okay, I can get through most of the day, but then by the time I get to like 6 p.m., I just collapse and I don't have the energy to do anything. I just feel utterly spent and I don't feel like myself. And then they try MitoQ and they actually notice that, oh, I do have that energy towards the end of the day. I do feel like I can function anymore. And that makes a lot of sense to me because of what I just told you about mitochondria even being important for sleep and fatigue and all that. So yeah, that is one way you can tell if your mitochondria is functioning. But I can go into others. I don't know if you want more details.
Yeah, it reminds me a lot of discussions I've had about NAD. And people would say the same thing.
Mm.
Why NAD declines also with age, like everything, and spermidine and NAD and like all everything declines, melatonin. So how does NAD contribute to mitochondrial function? And then what happens when NAD levels decrease during aging?
Yeah, so this is a really interesting question because I think there's a lot of kind of mystery about NAD in terms of what form should you take it in, what precursor I should say, and then also what is it really doing in the cell or in your mitochondria. And I will say this, so it's clear that NAD is decreasing as you age in various tissues. And it is also clear that NAD is very important for mitochondrial function in that it helps with electron transfer that helps generate ATP production. And so if you don't have enough NAD, you're not going to generate as much ATP. And for sure, you'll notice that in terms of fatigue. So very similar. I think people have told me at least that taking NM or NR, they're kind of feeling like their energy is back and all the rest. But there's also a lot of indication that, for instance, NAD in the mitochondria is very well regulated. So NAD has got a lot of different, I would say, like functions in the cell or things that it's doing in terms of signaling in the nucleus. And I think you've heard of things like sirtuins, for instance, which are really important for initiating DNA damage repair. So all those things I think the NAD is doing outside the cell, that is something where you might see more NAD depletion during aging in that outside the cell sort of function because, for instance, as you age, you are having more DNA damage, right? So you are going to need more NAD to address that damage, and you're going to deplete your NAD because of that. With mitochondrial NAD, you are actually doing a pretty good job of recycling NAD in the mitochondria, and your mitochondria are very good at getting more NAD to come in there. So I know this is a little bit confusing, but I guess I wanted to say that I don't know if NAD is the thing that you might notice first being depleted in your mitochondria and then having like this big effect on your mitochondria. You might at some point, but I think it's more likely you would notice NAD kind of depletion in the rest of the cell. So you might see more accelerated aging in the rest of the cell, for instance. I think you're also probably trying to,
Because
yeah.
NAD doesn't go into the mitochondria. Is it?
No, it does go in the mitochondria, but it's also, I think, very well regulated in the mitochondria, right? So, because you can imagine like the mitochondria need exact amounts of NAD to make all this ATP, and it's pretty good at kind of keeping the resources of NAD when it needs it. So it's very good at bringing NAD in from the rest of the cell if it needs it. I think the rest of the cell is where it's maybe not as well regulated. So if you have like depletion of NAD because of those sirtuins or PARPs, that's another thing that kind of depletes NAD, then there's not a good way of kind of bringing it back to those areas of like, for instance, the nucleus to do that DNA repair. But in the mitochondria, it is pretty good. That's not to say that it's not something that you can't have an effect on in terms of if you're really, I would say, having a lot of stress in your body, that you might have a little bit of NAD depletion in your mitochondria, but it's not the first thing that would probably happen. That's all.
It sounds to me the way you described it is like so we have this cell, and then inside the cell there's a bunch of mitochondria, 100,000 if you're an oocyte. And that's and then that seems like that's the factory, right, for making energy, and then NAD would be the food that it needs to make the energy. Is that in a fair analogy? Because you said it needs NAD. Mitochondria need NAD.
Yeah, it's more like the waiter that's bringing the energy to the right place in the mitochondria, right? So NAD is basically storing up energy for you in the term of taking protons and using these protons and electrons, I should say, to kind of bring a certain gradient into the mitochondria. And this gradient allows ATP to be made. So I always get a little worried when I have to start getting technical about how mitochondria work because it gets a lot of like different kinds of mechanisms to consider. So usually I just want to say like ATP production, it's about electron transport, and you need to have electrons kind of going through this certain chain, and then you make ATP and kind of leaving it at that. And then also just leaving it at NAD is the way that you get that electron transport chain to work best.
Okay, yeah, I know we need to simplify things because otherwise we tune out and it's like too much and it's so complex. So I understand, I appreciate, yeah, you trying to dumb it down for us to make it simple, but it is, if anybody's really nerdy may go, oh, well, we can get into the details, but we just want to know things in general. But as I understand, when people are doing NAD boosters, NMN, NR, or injections, IVs, that there's a problem because there's this salvage pathway called CD38, and then there's something called NNMT. And these are things that as I was explained to me, that those are the things that are actually depleting our NAD. So if you're taking these molecules, imagine a bucket full of holes, and the holes are let's say the CD38, and you're actually just putting in more NAD in the bucket, and you may feel good for a little bit, like a little energy boost, but in fact, the holes haven't been plugged. So you still are depleting. Your NAD will just keep depleting. And so it's maybe not the most effective way to improve energy, let's say. And it seems to me like the way I don't like injecting myself, taking a bunch of things. I think MitoQ may be a better way for me to improve the energy now, whether it plugs those holes, I don't know. But is there anything you know about that?
No, that is accurate. For sure, CD38 is consuming a lot of NAD, and it's kind of shown that CD38, because especially during kind of, I would say, disease states, is kind of going up and using more NAD. Like it does make sense that is the bucket that has the hole the most. But I'm just kind of pointing out there's a lot of different things that NAD is doing, and there's a lot of different ways that NAD is getting consumed. And for instance, CD38, that's not in the mitochondria at all, right? So it's actually kind of consuming NAD elsewhere in the cell. So it's actually kind of depriving other parts of the body, not the mitochondria as much, of that NAD. So yeah, that's at play. It's interesting about the IV situation because I know people talk a lot about NADs like obviously too big to be taken orally, and so you should take it as an IV and then you're all fine. I am not sure how well it works as IV either because it's still a very big molecule. I am not sure how much NAD that's floating around your bloodstream is getting into your cells that easily. So I think a lot of the time it's more likely to get metabolized and degraded into something else before it's going into your body and your cells and doing the job that people are hoping it's doing. So I'm a
Yeah.
little bit skeptical of IV NAD. I guess that's what I'm saying.
I'm still a little skeptical NAD, period. Like, I mean, I know it's an important molecule, but I just trying to understand it better. And are there better ways to improve the function of our cells? And we know that cellular health is just so foundational. And we do talk, I've had a lot of guests actually talk about mitochondria, and they may talk about products like CoQ10 or methylene blue, red light therapy, or peptides like humanin, urolithin A. All of these things are supposed to improve a mitochondrial function. So how do these compare to mitoquinol or MitoQ?
Yeah. No, that's a really good question. And I get asked that all the time. And I will say that a lot of these things seem very complementary to me. So I am skeptical, as you are too, of NAD and how much it's doing for quote unquote normal people. For sure, there's situations where, yeah, you would really benefit from NR, NMN, particularly maybe if you have heart disease, for instance. But I'm not sure if somewhat healthy people are really getting that much benefit from other things like urolithin A, like N-acetylcysteine, which is the precursor to glutathione, and CoQ10. Those make a ton of sense to me. I think that the mitochondria, because they are such a vulnerable place in our cell, and because I think they are kind of responsible for a lot of these aging mechanisms, anything you can do to take care of your mitochondria is going to be helpful, especially if they're all doing somewhat complementary things. So glutathione is also an antioxidant, different from mitoquinol, but it's performing, I would say, a very similar service, and it's dealing with oxidative stress in a different part of the mitochondria. So that's great. There's other types of, I would say, mitochondrial antioxidants that I'm particularly interested in that maybe your podcast listeners are not as familiar with, like, for instance, ergothioneine, which is a really interesting mitochondrial antioxidant that we've actually done some studies to show it's very complementary to mitoquinol in terms of things like telomere maintenance. We've also looked at things like PQQ. I don't know if you've heard of that one.
Mhm.
That's another mitochondrial antioxidant. It's kind of crazy. There's a lot of mitochondrial antioxidants. I would say not all of them are going to be getting into the mitochondria as well as MitoQ, but they all serve their purpose. And I think they can all have a place to help with a better, healthier aging.
Mhm.
So I think there's a lot of things I can recommend. And I would even just start with things like curcumin. Like I did a lot of research on curcumin, and that's a very effective kind of mitochondrial booster in various ways. So obviously it helps with the inflammation that can cause mitochondrial dysfunction, but it also seems to be directly interacting with the mitochondria. And for instance, I've done research showing that curcumin is very good for supporting overall brain function through supporting synaptic mitochondria and also improving neurogenesis, so increasing neurons in the brain. So things like that, which, like, as I think you're aware, is really hard to do. It's really hard to increase neurons in the brain. It's usually you're just stuck with the neurons that you're born with. But yeah, so some things can really help. So even a basic thing like curcumin can really help your mitochondria.
Oh, wow. There's so many things we can do. And we should take, I guess, this holistic approach and try different things and have them support support the other. But I've heard you mention that CoQ10, for example, can only get into the cell or the mitochondria, like 10% of it gets into the mitochondria. And whereas a mitoquinol can get, you said 90%, I think.
Yeah.
Like that's a big
Yeah.
difference, right?
Yeah, no, it's a huge difference. But I will also just point out that CoQ10 can perform as a very effective antioxidant for other parts of the cell, right? So CoQ10 is actually very important for lysosomal function. So I think many of these things are complementary. So I will tell you that we have had a lot of people using MitoQ that were trying to use CoQ10, for instance, for statin muscle pain. and said that MitoQ was a lot more effective because that kind of statin sort of depletion of CoQ10 in your mitochondria are not going to be fully addressed by something like CoQ10. Because as I have mentioned in other podcasts,
Hmm.
CoQ10 is not really having a great transport system into the mitochondria. So in that circumstance, MitoQ might be what you need. And CoQ10, it still has a place. It still can help the rest of your cell, the rest of your body is a great antioxidant, but it's not going to address everything.
Yeah, so there are people who be like, I'm just going to bang it out all sides, and other people are like, no, what's the one big lever? I'm just going to buy one thing, or I'm just going to do one thing. So I had the same discussion with collagen, like everything's a collagen booster, but like, well, okay, which one? I don't have time or the money to do everything. So it sounds like depending on the case too, MitoQ sounds like a pretty big lever. But can you explain a little bit how MitoQ came to be, like the structure? I know it's kind of similar to CoQ10 and there's some tags going
Yeah,
on.
yeah, it's
That's
an
all about.
interesting
Is it
story.
natural?
Yeah, because it does. Yeah, no, exactly. It does have a very similar structure to CoQ10, but it was designed to kind of be a better CoQ10. And the situation is that, yeah, about 30 years ago, these scientists in New Zealand, Mike Murphy and Robin Smith, were trying to figure out we need the mitochondria to be protected better during aging. We know it's a very vulnerable place, all the things I've just been talking about. And CoQ10 is not really going into the mitochondria that well if you take it orally, as well as many other types of antioxidants. So they're like, what can we do to make it get into the mitochondria better? And so they did a very clever thing. They basically took the sort of antioxidant part of a CoQ10, the quinone, and they attached it to this thing called triphenylphosphonium ion, so also called TPP. And this TPP is very positively charged. And it just so happens that the mitochondria are very negatively charged. So through chemoosmotic kind of like mechanisms, basically, as soon as you introduce the MitoQ into a cell, it just goes directly into the mitochondria as the most negative place in the cell. So in that kind of way, you can get this incredible accumulation of mitoquinol in the mitochondria up to 90%, where with CoQ10, it's just not getting any kind of direction to go in the mitochondria. And it's also too big to get into the mitochondria. And so this is, I think, what I was really clever about this MitoQ invention. So the funny thing is that it's just not well known because I hate to say it because it was invented in New Zealand. I think New Zealand just is such a small place. And even though there was a lot of interest in MitoQ all over the world, so I think I mentioned that we have 25 clinical studies. We have over 900 studies published on MitoQ. So a lot of researchers are really interested in MitoQ. And in fact, my company doesn't pay for any of this. Like we just have researchers come to us all the time, basically saying like, we think MitoQ is the answer for COPD, or it's the answer for ALS or Alzheimer's disease or COVID or long COVID. And we basically just give them MitoQ to test out these things. So that's, I think, what's really cool is that it's so unique, this kind of special ability it has to get into the mitochondria and protect the mitochondria. It's just a lot of different ways it can be used. So, especially obviously for aging.
It's crazy that I've never heard of this before until now. And it's not new. How long? Because you've done so many studies and clinical trials. Like, how long has it been around, or when was it discovered?
Yeah, so it was, I would say, kind of invented maybe about 25 years ago. So it took a while for these scientists to get the right version. There are a lot of different versions that they tried. And then as a supplement, it's been around for about 10 years. And during that time, yeah, like there are a lot of clinical studies being published and all sorts of nice effects in terms of like liver health and exercise and anti-inflammation. And I will say that because it's a very small company, MitoQ, that owns this molecule, and we're just this one company talking about it, we just don't get the word out very well. So I'm really hoping we can get the word out because, yeah, everyone's heard about urolithin A because it's basically owned by Nestle, which is a huge multinational company.
Really?
No one hears about MitoQ because it's just this tiny company that's talking about it. So we're hoping that people get more understanding of it and want to try it themselves.
Yeah. Actually, even Neurolithin A is new to my radar, and I think a lot of people in my audience as well. And like MitoQ has lots of research, but it's been around for a while. And you think, well, why is it taking so long for me to find out
I
about this?
know.
But you mentioned MitoQ has 25 clinical trials, over 900 peer-reviewed papers, and I understand more than $60 million invested in independent studies, some at Harvard and UCLA, and that's really rare for a supplement company. So which study stands out most for you?
Oh, all right. I mean, I think I am most impressed with some of the cardiovascular effects of MitoQ because I think, as I mentioned, They're something that you can generate very quickly. As I've mentioned, just with one bolus amount of MitoQ, you can kind of bring vascular function back 15 to 20 years younger. But what I'm kind of excited by right now is some of the data we're generating in diabetes. So for example, a study that just came out like a month ago was looking at people who have diabetes. And I don't know if you're aware that when you have diabetes, you're very much at risk for cardiovascular dysfunction. And it kind of makes sense, right? Because as a diabetic, you're no longer using energy as well. And especially your mitochondria are having a little bit of dysfunction. And this especially affects your heart. And so what they did is they kind of looked at what happens to people who are full-blown diabetics. Over time, they start to have more and more heart dysfunction. So they're not making as much ATP anymore. Their overall mitochondrial efficiency is going down. And this can be like the very early kind of generation of heart failure. And so in this study, they gave MitoQ at 40 milligrams for 3 months. And they showed that basically you could bring back mitochondrial efficiency in these diabetic hearts by up to 15%, which is kind of mind-blowing. So it's basically like that much more ATP generated, that much more heart function, the difference between not being able to like have like the physical performance you want, the sort of daily activities, feeling like you can actually function. So I'm really excited by that because I feel like that is one of those things that can really make a difference in long-term health. So yeah, so this study actually got a lot of press. And yeah, I was really happy about that because once again, I feel like diabetes, it's going to be just a nightmare in the next few years. Like more and more people are going to get it. I know the GLP-1s should be the answer, but I will also tell you, I don't know if people are going to stick to GLP-1s for as long as they need to. They're a tough scene. So yeah, I think this is another way that people can protect their health.
I'd love to get that study too. I just put it in the show notes because I think you're right. I did just recently a blood glucose challenge with our community. We're all wearing the blood glucose monitors and seeing how our body reacts to food and exercise and stress and sleep. And you mentioned in the beginning of the episode that insulin resistance and women in menopause. And of course, this is a contributor to diabetes if we don't get it under control. Can you share with us a little bit more what you learned, or I don't know if it's your research, things that you mentioned before you'd like to take a deeper dive into?
Yeah, well, I will tell you, I think CGMs are the best thing ever for everyone. I have also used CGMs and I am so surprised what I learned too. I thought I was very good at nutrition. I knew all the tricks. And I was surprised to realize that, oh, wait, when you think you're eating something that's whole grains and like lots of fiber, you are still making your blood glucose go up like crazy. And that is really bad for you. So that was shocking for me. So I'm never having another naked carb ever again. I can tell you that.
Naked carb, meaning just like a couple of grapes by themselves without.
No, yeah, never, ever, ever, ever again. I'm like going to have a slice of cheese with those grapes, and you will not get me to do any kind of like just eating some candy by itself. I am going to go and have like, I don't know, like a tin of sardines or something.
I learned a
But
lot too.
so
Yeah, but for me it was watermelon. And but
really,
yeah, the thing that had the biggest impact, I tried apple cider vinegar, berberine, eating salad or vegetables before the actual meal or the fruit. For me, it was I eat way too much fruit. I realized I ate a lot of fruit. Like it's healthy, it's good for you. So yeah, like you said, naked, I can't do again. But the thing that had the biggest impact for me was moving after I eat it. And more than anything else, it was like whether I go for a 20-minute walk or whether I do 3 minutes of air squats, like the bump was either non-existent or very low. So I don't know, yeah, what, and as we age, as we go through menopause, actually, we become more insulin resistant. So I think this is another a great challenge for every woman to do because maybe you eat watermelon, you'll be fine, and I can't, or vice versa. So we're all so individual. But what else have you learned about blood sugar and menopause?
well, all right. So I think the big one for me is that, yeah, so I mentioned before that night sweats were not good for you. I think I just want to explain a little bit about why that is. And really what's happening when you're having night sweats is it's a sign that you're breaking down myelin in your brain. And myelin is basically this kind of fatty coating that coats all your neurons and helps signals between neurons go faster, right? So, for instance, our brains are just covered in myelin, and also our body is covered in myelin. And when you lose myelin, you get things like multiple sclerosis, right? Which is like this really terrible movement disorder. So, what's been shown is that when you're having these night sweats, it's basically a sign that your body has stopped using glucose as well, and especially your brain. And it's now going to break down myelin because it doesn't have any other fuel source it can use. And once you start to break down that myelin, it's really hard to put it back in again. So that's, I think, what is really interesting about things like diabetes or glucose is that if you're not able to use glucose, you're going to find something else in your body to use, and myelin is one of them. In fact, there was a really interesting study, I don't know if you heard about this, where people who run marathons actually deplete myelin in their brains kind of temporarily. And it takes a few weeks for it to get back because these are very healthy people that are doing marathons. But, with someone who's in perimenopause and having these night sweats again and again and again, it's not clear if this myelin depletion is going to come back. And for sure, it's really also clear that myelin depletion, it's also called white matter in the brain, is a huge risk factor for Alzheimer's. So I think that's something that's really interesting for people to understand about menopause.
I didn't know that. That's crazy. So yeah, this is something again, women, please don't ignore, don't those hot flashes and night sweats. You could be
Yes.
depleting your myelin sheaths, which are protective. And I like to explain to people it's like an electric wire, right? It's the coating on the wire that's the myelin. And imagine even if you have that cut, if it's broken and then eventually the electricity, the wire is going to be cut and not do well, you won't be able to get the signal to turn on the light. And it's just kind of a very simplistic way to explain it. And that's why myelin is so important. We want to keep that coating protective layer to avoid all of these dementia and any other neurological problems. So we're going to have to wrap up. I've asked you so many questions. I still have so many, but okay, we're going to.
I know. Sorry, I am very long-winded, so I apologize.
No, and I'm contributing to this too. I think it's a very important conversation. So let's talk about the top three things that anyone can do to improve mitochondrial function.
All right. So I don't want to go into exercise too much because I think it's such an obvious one, but I also just want to point out that we all say we're going to exercise and very few of us do it enough.
Mhm.
So I used to work at Noom, which is, this company that works on how do you lose weight most effectively through habit formation. So I'm kind of an expert in habit formation because I think that's really the key to good health is how do you get things to be easier for you. And I will say exercise can be made easier through a bunch of different mechanisms. One is a little bit like what you said, like, if you eat something and you're kind of like, oh, that wasn't great, just go out for a 5-minute walk. Just a 5-minute walk can be like a huge thing. Or just, take some stairs, go up and down stairs for like 5 minutes. It doesn't have to be a huge thing. So I think that's a really important one. The other one is this is something I have just learned recently, and I think this is really cool. It's going to be a little long-winded, I will just warn you, is that a lot of the feeling of like, oh, I hate exercise is from like that terrible fatigue you get, just like, oh, I don't want to do it. I'm kind of in pain. And this is because of this lactic acid buildup, right? So we all know that lactic acid is, the kind of sign that your muscles are generating so much energy needs that you can't really give it all the energy it needs in terms of oxidative phosphorylation. And so what I think is really interesting is that there's a recent study showing that when lactic acid is high in your brain, because of the fact it's high in your bloodstream, it is actually decreasing motivation. So if you have increased lactate in your brain, you actually have less motivation to do anything. And so I think that's really fascinating. So it kind of tells you that if you can somehow control lactic acid in the rest of your body, especially while exercise, you will probably have more gumption to do exercise. So what can you do to make that happen? So magnesium is really good at reducing lactic acid. There's like a bunch of polyphenols that can be very effective. So like black currant juice and things like that and blueberries. So yeah, I would just encourage people to try that. Oh, and sodium bicarbonate, that's the big new thing right now to try with exercise. I kind of think one of the things that makes it work so well is it basically is making it so that you feel like you can do the exercise more. So that's my theory. I've not tested it yet.
Yeah, but when the research that shows some of this, is it taking just a couple hundred milligrams of magnesium before you exercise, or is this after, or sodium
I
bicarb?
will
Like,
have
how do
to,
we do this?
I am not sure of the dose. I can look up the dose for you and let you know.
And when and
But
how? Like, that's the kind of thing that.
oh yeah, before exercise, obviously. But I will check on the dose for you. Yeah.
So there's another molecule, and I just can't remember, but there's a post on my Instagram because a friend of mine told me about some research that came out that helps lower lactic acid with your workouts, and so you'll be able to, go better and actually be more motivated. And I think it was maybe butyrate. I don't know what. I'll have to go back to that or if anybody's listening now, just scroll down, or I'll try and find it and put it in the show notes, because it was a really cool hack. And if that's true, what you're saying is that we're having this stickiness to the bad feeling we have with lactic acid, then it's better to remove that and know that we'll be fine. So that's super cool. Okay. So exercise, and then get some, get some either magnesium or.
Yeah. And then the other one I think is really important for mitochondria is, you've heard this before, is stress reduction. Because we all know that high amounts of cortisol are really bad for our mitochondria and everything else, your blood glucose and the way you're, accumulating fat and inflammation and all that. So yeah, that's the other one. I could go on about stress reduction and how to do it, but I think your listeners probably know a lot about that.
Yeah, we have whole episodes on that. But I also want to just repeat what you mentioned at the beginning of the episode, is those relationships that we have with others that count so much towards healthy aging. And I'm sure probably the mitochondria, because you're reducing stress and all that. But there's the Harvard study of adult development, which is one of the longest longitudinal studies ever done, showing that these relationships are important. Again, positive ones. If you're in a toxic relationship, that doesn't count. But nurture your network is what I always say. It's such a powerful tool. And I mean, we love to talk about supplements and ice baths and saunas and all the biohacks, but the real biohacks are really grounded in some of those relationships we have. But I'm excited actually to test my cardiovascular health with MitoQ. And I know you have a MitoQ Heart, you have MitoQ Eye. Those are the two that I got. And I have the MitoQ Pure. So I'm doing my own testing now, and I'm always looking at improving the heart and the eye. So I'm going to report back to you. But what I do love is those capsules are teeny tiny. I'm like, yes, easy. And you take just one before you eat. Is there a reason for that? Or what if I forget?
It is important to take MitoQ before you eat and then wait at least half an hour, because its absorption is best on an empty stomach. So yeah, that is something that's good to remind everyone. Is just, if you want it to be effective, don't have it with a big, huge meal. You can have liquids, that's fine, but just, don't have a big, huge meal with your MitoQ.
If I take my essential amino acids at the same time, it's okay, no? And creatine, or should I keep them apart?
I mean, I think you're not taking that much creatine, right? Like 5 grams.
Yeah,
that's fine.
It's standard.
Yeah, just don't take a huge meal.
Yeah, no, I know, I don't. It's okay. And I don't have to eat after 30. Like if I do it an hour or 2 hours, I don't know, if I were to, as long as the stomach is empty is the important.
Yeah, exactly.
Oh my God, this is so interesting. I am so excited about MitoQ, and I hope this becomes a household name for everybody because it's such an incredibly researched molecule. It's been around. And again, it just blows my mind. 900 peer-reviewed papers, 25 clinical trials. It's amazing. So there's evidence, and I'd love for anyone who wants to try it. I'm sure I have a discount code somewhere. I'll put it in the show notes. And if not, you go to mitoq.com and then check out all if you want to target the heart and the eyes like me, great. And you have curcumin, I think you've got a lot of other formulas depending on what it is you want to target.
Yeah, blood sugar, whatever usually is like your main concern. We have something where we've built a formulation to synergize with MitoQ. So I think there's a lot available.
So cool. Love those synergistic effects. Is there anything else that we haven't covered that you want to mention before I let you go?
No, I think we had a really good conversation, and I really found this like a really stimulating kind of digression into all sorts of different things I usually don't get to talk about. So thank you so much.
Oh, love it. Yeah. We're talking about brain health and insulin and menopause and mitochondria, NAD. I appreciate your expertise as well, because we get so confused about many of these topics, and you've got such an incredible background. I'm so grateful that you came on and gave us your time. And if anybody wants to check out mitoq.com, go to the website. And also you have an Instagram as well that I'll have this in the show notes. And I appreciate everyone who made it to the end, who were very curious about mitochondrial health and menopause and all these topics. We wouldn't be here without you. So thank you for listening. And thank you, Siobhan, for giving us your time. Have a wonderful evening.